In 2007, a team of researchers from Arizona, Arkansas, and California published a study on how they were able to reduce energy consumption in a community in the United States. And what they did wasn't particularly new. They sent communities, or homes in this community, a simple piece of information in a letter saying, here's how much energy you used. But since a home is not in itself, by itself, it's part of a community, they also included in those letters the average amount of energy being used in that community. And for the homes that were using more than the average amount, they found in the period following, those homes used less energy. Now, there are other homes in that same community that were using less than the average amount. And in the period following receiving the same piece of information, that this is what the average amount was, those same homes increased the amount of energy that they used. Now, this is problematic, because what it looked like a good tool and a good intervention was essentially wiped out by having a negative back-end effect. Now, the researchers refer to this as a boomerang, which is where what was positive in one group was essentially erased by the negative in another group. But the question is, why does this happen? And what do we do about it? Well, the key thing is to go back is to say, well, what was the goal to begin with? What were we actually trying to achieve? Well, in a community, you have homes that are using a large amount of energy and a smaller amount of energy. In a perfect world, we would say, the homes that are using a lot, we can have some sort of intervention to get them down to using that smaller amount used by others. Unfortunately, we don't live in a perfect world. So the idea was actually to say if we could reduce the amount of energy being used in the homes where people were using a lot without increasing the amount used in others. Because by doing this, we would reduce the average amount used across this community. And the cumulative benefits of this for both the environment and individual economies would be very big. So they went back and they had this very simple addition that they made to their study. And all they did was for the homes that had been using a lot, they simply said, that's not good. And they provided the average information about the community as well, thumbs down, frowny face, in the same sort of letter. And they found that after doing this, there was again a reduction in how much energy was used in these homes. But then, for the homes that had been doing well before and had been using a relatively small amount of energy, they said, thumbs up, smiley face, keep going, and encouraged to continue with this approach. And what they found is that in this moment, there was not actually a substantial increase in the amount of energy that was used. And so overall, they saw a reduction in the average energy use in that community. So essentially, you could say that goal had been achieved. Now, this isn't just about energy use in the United States. It's actually going a lot further, and similar tools have been used in many places. Let's go to the United Kingdom. They decided that they had different trials of ways to get people to pay their taxes when they hadn't done this. But they wanted to come up with a new way, so they also used letters. And they said, rather than telling people, you haven't paid and there could be this fine or this sort of penalty, instead, they simply said, did you know that the vast majority of people in your community have already paid their taxes? Or that the vast majority of people who owed the same amount of you have already paid their taxes? And they found a moderate effect for this intervention, and they found that once implemented, the cumulative benefit generated the equivalent of about $300 million in added revenue from this small intervention and a simple little change. Now, why do I tell you about this? Of what value is it to know that changing up the way that we get set letters will change our behaviors? Well, the two examples I've just given you are perhaps the most telling prime examples of a sprawling area of research and practice referred to as behavioral economics, which is typically applied through the tool of what's called nudge theory. It's difficult to overstate just how much this is changing the way policy is done globally, not least because there are now more than 100 institutions around the world in governments, academic institutions, and non-governmental organizations implementing what are known as nudge units, which are looking for similar sorts of interventions that are low cost and moderate to large effects on the way we make decisions and their outcomes. It's also because the person who's probably the greatest champion of nudge, Richard Thaler from the University of Chicago, was just awarded the Nobel Prize in economics. So it's basically true to say that they are fundamentally the way that we develop policies to address major social challenges. These challenges include things like environment, education, and economics. So let's talk about some examples. Staying in the United Kingdom, we're all aware that the use of plastics are a real threat to our sustainability, both the environment and the way that we generally consume goods. In 2014, the British government estimated that around 7.6 billion plastic bags were used in a single year. So they decided to implement a small charge. 5 pence, roughly the equivalent of 7 American cents. Now, this amount does not influence the vast, vast majority of the British population. It's essentially an inconsequential amount of money. Even when totaled up over an entire lifetime, this will not influence the quality of life for anyone. And yet, implementing this small charge for the use of plastic bags, in the year following when this was implemented, the reduction in plastic bags went down 6 billion by simply introducing this seemingly inconsequential value of money. These impacts aren't only being seen in the Western world. We go to the Philippines. In rural areas in the Philippines, the use of savings accounts and banks are not necessarily as common, even by standards in Eastern Asia. So a team of researchers there came up with an idea that they would have people enter into contracts, and they would sign these contracts and say, I commit to saving this amount of money over this amount of time. And these seem to work pretty well. But the thing is these are not your standard contracts. They weren't legally binding, and they weren't with a bank. The only people involved in those contracts were the individuals themselves, signed off by themselves. And they simply said, I commit to myself to save this amount of money over this amount of time. After 6 months of this intervention, the use of savings accounts increased nearly 50%, and after 12 months it went up to 80%. Education. The importance we're now placing on trying to understand better how our way of assessing and teaching is influencing the way people choose not only perform in schools, but choose their careers later, particularly in the context of how students perform on standardized tests. We'll become increasingly aware of how this influences particularly career decisions related to the STEM subjects. And multiple studies have now shown that when we introduce things like questions about gender and race and ethnicity and age at the beginning of tests, that it can have influences, such as showing that more boys were passing these exams than girls. But with the simple change of moving the question about gender to the end of the exam, we found that boys and girls were passing at about the same rate, or these researchers have in these particular studies. And it's moving these simple changes around that have had a very substantial effect. But even as these have been positive, there have also been some drawbacks, one of which is what Thaler refers to as sludge, which is where the exact same sort of tools, these simple changes, have been used not for the good of the individuals targeted or society at large, but as a form of consumer manipulation. In other cases, they simply backfire. They don't have their initial intended effect. Speaking from our own research, we did a study where we asked young people, and actually just generally the population, how they viewed the idea of refugees being allowed to settle in the country. When we simply asked that question, would you be okay with this? The vast majority are in support of the idea. So we varied up the way the question was asked and put it in a number of different contexts and situations. And we find, typically speaking, more than 50% of people are in support of the idea of refugees coming into the country. In only one condition did we actually find this changed. In one condition, we asked people if they would choose, if given the option, to spend money in supporting the hosting of a refugee or spending it on local health services. This changed. The majority was now against the idea. On this very campus, we ran a very small survey looking at views about student tuition, something that probably hits close to home for many of you. And we asked a very simple question, and that was, would you be okay with the idea that people who have certain needs, particularly financial, would be allowed to pay a lower tuition than you if you didn't have those same needs? Over 80% of you were fine with this idea. When the question was asked in a different way, which was, would you be willing to pay a higher tuition in support of scholarships to support those with needs, such as financial? This dropped below 50, down to 44%. Now, this is not a question of your pro-social values, your beliefs, or your ethical views. It's simply an example of how much if we change the way information is presented, it can have a substantial impact on the decisions and their eventual outcomes. But the question becomes, why do any of these have any real impact? So my team put together a massive number of studies that we looked through, and we found over 100 examples of nudges being used in policies. And we looked through, and what we found is, in many cases, we can see that they're working, and in individual instances, a little bit as to why. But we find that there's no underlying theory as to why these small little changes seem to have such a longer-term effect. So in short, we seem to know that they seem to work, but we still wonder why. To get to that answer, or to start understanding how, or to try to put a definition behind it, we have to go back to what's the point of policies to begin with? Well, the idea is that in any population, in any major social challenge, we assume that there's some people in the population that aren't doing particularly well, some that are doing okay, or a little better, and a smaller number who are flourishing, those who are doing exceptionally well. The idea with any policy is to reduce those who aren't doing well and increase those who are doing okay and even better. That's essentially the point when simplified. So, in looking through this, we also found 200 examples of tools being used in interventions, nudges, for example, that seem to have a really major effect on our decisions and behaviors. And what we found is when these were implemented, typically they were related to things like our biases, our rules of thumb that we rely on every day, or just common human error. And we found that there seemed to be 4 common themes that related to the most effective ones when implemented, trying to make a change in something. Let's refer to this as forward theory. And those key elements go like this. In the first instance, one of the most common things we see in the most effective interventions is that the actual decision point didn't change. You could still use whatever amount of energy you wanted. You did not have to enroll in a savings account. The questions on the test did not actually have to change. So the actual decision point was often left unchanged in the most influential ones. Second, equal attention was paid to the positive gains made in each intervention as to the negative ones. We didn't simply ignore when they didn't work and focus on where they did, but in the ones that were most effective, equal weight was given to the positives and to the negatives, and dealing with those exposures was seen critical. Now, it won't surprise many of you that in the last few years, I've had more than one time where I've spent an additional 5 minutes before going to bed pacing around my living room so that my phone will show that I've taken 10,000 steps that day. You might be able to relate. A clear, simple goal is often something that's missing in the less effective interventions, but something that's very prevalent in those that are most effective. That's a simple example. Let's take a more complicated one. The last time you either witnessed or participated in a debate about taxes. Presumably, a lot of that conversation had to do with ideological views about how much people should pay in some theoretical percentage based on how much they earn compared to a population. But imagine instead of having a conversation from that angle, we focused it more on how much do we need to solve the challenges that we face, or to have the society that we really want? And if we focused on what was the actual goal of it, as opposed to just what are our general beliefs that might interfere with that simpler conversation about what are we actually trying to reach. And then last, and most important for tonight, is that better seems to beat perfect. The big home run interventions don't seem to work nearly as much as those small incremental changes, but those small incremental ones add up over time and seem to make a much greater impact in the longer term. And this is where we've been trying to focus our own work. So what do we do with all this? What value is it to say these things to you tonight? Well, consider those 10,000 steps and consider some of the major challenges we face around the world. Consider obesity, a major challenge considered not only in this country but in many countries. In Brazil, using that same 10,000 step goal with a small group of obese individuals, simply offering them that goal of 10,000 steps a day over a relatively short time period, they showed tremendous benefits for both physical and mental health for a small group of people who had that goal. We're living in an aging society. We live longer, we spend more years in retirement, and yet fewer Americans have anything saved for retirement, and fewer Americans are using pensions, particularly at a sustainable rate. And yet a small intervention or a small change in the way contracts were set to change the default so that people were automatically enrolled in a pension for a small percentage of their salary unless they chose to get out of it, showed that a spectacular number of people from after, compared to before, were now enrolled in a pension. And these simple little changes where people could still choose out seem to have a major impact on the number of people involved in these interventions or invested in pensions. So the idea here is where we can start looking for these major challenges, these major issues that we're trying to deal with, and where can we come up with these small incremental changes, these small interventions that may have these serious effects over time, or these substantial ones. So the idea was that each of these we start taking small steps forward, that no one is going to make everything perfect because that's not the society that we live in. But we can make individual small steps forward, and those add up over time, even if the occasional one works in the wrong direction. So in no individual case will one be perfect, but they will consistently be better, and that we will consistently move forward. Thank you.